a new technique that enables scientists to take chemical images, a high-intensity X-ray beam that shows patients why their hip replacements didn't work, and feeding time for a swarm of sandflies are just some of the things Imperial College London researchers will be showing visitors to this year's Royal Society Summer Science Exhibition.
I visited the Leishmania hut to ask Tom Cloak about the parasite.
So leishmania is a parasite that causes the disease leishmaniasis, hence the name. It was discovered by a Scottish pathologist called William Bogue Leishman. That's why it's called leishmaniasis. And it's a disease that can affect the skin, causing lesions on your arms or exposed parts of your body, but it can also affect the internal organs, your liver and spleen. And in this case, it can be a fatal disease if it's not treated properly.
So what's this exhibit all about?
So the exhibit here today, we're looking at leishmania and leishmaniasis, and inspired by our fieldwork in Ethiopia, we kind of just constructed this kind of Ethiopian stylized hut where we invite people to come in and have a look at. We've got some lizard leishmania parasites which would infect a lizard but won't infect any of the visitors coming to our exhibit. We also have some uninfected sandflies for people to look at, which are the insects that transmit leishmania disease.
So at the moment I'm trying to encourage these sandflies to feed on my blood. So I put my hand into the cage full of sandflies, and in fact one is starting to feed already. I can feel it on the top of my wrist. Once they start their feeding, they're actually quite insensitive to what's happening around them, and it's quite hard to remove them from feeding. It's quite hard to dislodge them. So I can feel the tiny pain. It's like a little needle going into the skin. It's not like a wasp sting or a bee sting. And that's how the transmission of leishmaniasis occurs.
Why would people be interested in coming to see this exhibit?
Well, I think everyone likes to learn about diseases that have a real impact on people's lives. And leishmania is a disease because it affects the skin. People often get really quite horrifying lesions on their face and on their skin, and it's a disease that can easily be confused with leprosy, and this leads to a lot of people getting kind of stigmatized and ostracized. Women find it difficult to find husbands, children often aren't able to go to school, so I think the human implications of leishmaniasis are really very important. I think that will hopefully interest a lot of people, and they'll be able to kind of try and really empathise with the people that are infected with the disease.
What are you most looking forward to about this week?
Well, we have a special visitor tomorrow, we believe, hence the Royal Society and its kind of patron, we hope, may be visiting us tomorrow, so we're going to see whether Her Majesty herself may be able to learn a little bit more about leishmania and leishmaniasis.